quickly be talking about the concept of eruptive xanthomas. Now, the concept of eruptive xanthomas, I personally came across it when I was reading about dyslipidemia. So, eruptive xanthomas is basically something that will appear on your skin, right? So, due to YouTube new rules of shocking content, I can't actually take these lectures with pictures in it. But if you want to see the pictures of eruptive xanthomas, you simply what comment. So just like I told you guys, one of the top causes is what hypertriglyceridemia. So triglyceride levels in the body are kind of like very high. Okay, it's an example of dyslipidemia, right? So for the overview, we say that eruptive xanthomas are small yellowish bumps that appear on the skin, and this is due to the high levels of triglycerides in the blood. They are often associated with conditions such as what diabetes, it could be hyperlipidemia, it could be hypothyroidism. All right. So what are the characteristics? These patches, they're like patches. They are small, shiny bumps that are typically 1 to 4 millimeters in size. They can be yellow, they can be pink, they can be brown, or they can even be the color of your skin. Right. Location, they are commonly found on places like the buttocks, the shoulders, the arms, the legs, but can appear anywhere on the body. I've told you guys that if you want to see the picture of the eruptive xanthomas, you simply comment and I'll drop you a link to access it. Okay. Symptoms, they may be itchy or painful, but often they are asymptomatic. Okay. Causes could be what? Hypertriglyceridemia, high levels of triglycerides in the blood. It could be diabetes, which is usually due to what? Poorly controlled diabetes. Right. Poorly controlled diabetes can lead to what? Elevated levels of triglycerides in the body. It could be due to some medications that are taking currently. So certain medications like what? Isotretinoin, estrogens, and cyclosporines can increase what? Triglyceride levels. Okay. Other conditions like what? Hypothyroidism, obesity, and liver diseases, all of these can actually contribute. So what is the treatment? If I say many things can actually cause an eruptive xanthoma, the treatment will be more of like if you treat those things, eruptive xanthoma will no longer be there. All right. So address the underlying cause, treat the underlying condition, such as managing the diabetes or managing the hyperlipidemia. All right. Then diet and exercise, reducing saturated fats, sugars, and increasing physical activity can all help to lower what? Triglyceride levels. Medications, in some cases, medications may be prescribed to manage what? Triglyceride levels. Prognosis. For resolution, eruptive xanthomas are often resolved once you treat the underlying cause. Do you understand? Regular monitoring of triglyceride levels is important to prevent what? Reoccurrence. Eruptive xanthomas, that's for the conclusion now. They are generally benign but can be a sign of what? An underlying metabolic disorder that needs attention. So you always treat it with what? Emergency. So that's it for eruptive xanthomas overview, characteristic, causes, treatment, and prognosis.